Good afternoon. So welcome to Thursday Reading Live. This is me Vandana PS joining you from Needhu's Academy. Okay, so as usual we have a sample question from part B here. Then we will move on to part A. So I'll give you 2 minutes for the preparation of this question. Then we will discuss. Okay, so here comes the question. So welcome back to the reading live. Okay. Hi Sunida, Libby, Reba, Janita, 𝐿𝐴𝐺 𝐒𝐿𝐴𝐺, good afternoon. Okay, so what about the question? Any idea what is the correct answer here? Hi Rincy, how are you dear? Okay, so any idea about the answer? Did you all do the question? Okay, so I'll read the question, then let's discuss about the answer. Okay, so what prompted the clinic to seek governmental intervention? So as usual, after reading the question, it's important to mark the keywords. Okay, so what are the keywords from the question? So I'm marking prompted. Okay, prompted, then seek, intervention. So these are my keywords from the question. So question is not asking you why they approached for the governmental help or government intervention. They're asking you for the reason. Okay, what prompted them? So what is the reason behind they approached the government? Okay, so because of increased client demand, option B, increased funding, and option C, increased facilities. So my keywords, client demand, then funding, then facilities. Okay, so as you can see here, A, B and C, it's look like the same, but the only different words are client demand, funding, facilities. Okay, hi Tinsy, good afternoon dear. Hi Nijita, good afternoon. Okay, so any idea what is the correct answer here? Any idea whether it is option A, B or C? Okay, let me know in the comment box about your answer. Okay, so I'll read the paragraph. Leaflet, sexual health services at the clinic. Then sexual health is a state of well-being that regards the physical, mental and social aspects of individual and sexuality. Then individuals crave a respectful approach towards their sexuality as well as sexual relationships about the choice of having possible, pleasurable, safe sexual encounters that are free of correction, violence and discrimination. Our clinic provides sexual and reproductive health services to our clients. Then the facilities include circumcision, treatment of STIs, and counseling for victims of gender-based violence. And in the UK, the number of people who seek sexual health service has increased to more than 3 million people per year. With new demands of the service, last year, we called on the government to consider providing more funds for the services to be adequately provided. However, that was not forthcoming, with ministers quoting recent departmental budget cuts from 3.3 billion euros to 3.3 billion euros that caused a deficit in the provision of services. Okay, so question is asking you what prompted the clinic to seek governmental intervention or what prompted them to seek the help from the government. So why? Any idea what is the reason? Hi Imran. Yes, Shanta, Monica. Yes, good afternoon. Okay, so any idea about your answer? Which is the correct answer? Okay, maybe your answer is option A, right? Okay, why? Why option A? From which line you got that answer? Option A, increased client demand. Okay, Reshma, it's B. Okay, why it's B? Okay, Riba, option A is the answer. Okay, why option A? Any idea? Okay, Dar, it is option A. Okay, why dear? Any idea? Which line? Okay, in which line they've mentioned about option A? If your answer is option A, from which line? Or if it is B, then how you get option B? Increased funding, then increased facilities. Okay, hi Shabna, good afternoon. Okay, so I'm coming back to this question. So what prompted the clinic to seek governmental intervention? Answer is option A. Okay, why? Increased client demand. See this particular line. Okay, in the UK, number of people who seek sexual health services has increased more than 3 million people per year. So what is the number? About 30 lakhs. Okay, 3 million, which means 30 lakhs per year. With new demands of the service, last year we called on the government, so which means we requested to the government to consider providing more funds. So why we seek governmental intervention? Okay, because of the demands of the last year, or because of the with new demands of the services. And what we need more funds. So question is asking you about what prompted them? So what is the reason for asking for increased funding? So what is the reason? It's because of the demands. Okay, so answer is option A, increased client demand. What about option B? It is mentioned there, but it is contradictory because it's not because of funds, it is because of increased client demand. And option C, not mentioned anywhere. So my answer is option A, because of increased client demand. Okay. Yes. Okay, Shanta, Monica, Libby, Shapna, Imran, it's option A. Very good, very good. Excellent. Okay, then what about part B? Okay, how many questions in part B? Okay, Monica, it is from the fourth line, right? So fourth line, which means 1, 2, 3, 4. Our clinic provides sexual and reproductive, right? Okay, actually it is in the very next line. Okay, so what about part B? How many questions in part B? Any idea? What about the number of questions in part B? Okay, Monica, you, okay, happy. Okay, Imran, 6 questions, very good. So what about the type of question? What type of question? Okay, Shanta, yes, 6. Okay, Reshma, 6 questions. Okay, so what about the type of question? What type of question? Okay, Libby, 6 questions. Okay, so what type of question? Okay, Shapna, yes, number is 6. 6 number of questions, yes. Okay, so type of question, which I can say multiple choice questions with 3 answer options. Okay, in part B, we have multiple choice questions. So as you can see here, for example, there will be a question and we have 3 answer options and you have a respected paragraph. Okay, and the question can be categorized into 3. Any idea what are the categories? Okay, Riba. Okay, Shanta, guidelines, protocols. Okay, dear. Okay, then 3 categories. What are the 3 categories? In part B, we have 3 categories of questions. So what are the 3 categories? Any idea? Okay, I agree. One is guidelines. Then what about the rest? Remaining 2. The first category, which are guidelines. What about the second and third? Any idea? Second and third category. Okay, okay, Monica, multiple choice questions with answers. Yeah, okay, that is a type of question. And what about the category of questions? Okay, Imran, memo, email. Okay, yes. Opinion. So, opinion, which means? What opinion? Actually, opinion related questions will be in part C. Okay. So, writer's opinion, writer's suggestion, writer imply. So, which means that will be in part C. Okay, Imran, notice. Okay, Riba, guideline, manual or policy, memo, notice, email. Very good. Okay, lexical. Again, lexical questions will be in part C. Okay. Okay, Monica, guidelines, emails, policies. Okay, Shanta, memo. Okay, Libby, memo, notice, email, guidelines. Okay, Alina, manual and policy. Okay. So we have 3 categories in part B. The first one is guidelines. Okay. Then second one, I can say manual or policy. And the final category, which is emails, memo and notices. Okay. So these are the 3 categories. First one, guidelines. Second one, manual, policy. And third one, email, memo and notices. Okay. Yes. Okay. So what are you reading for in the first category? Suppose if question is asking you regarding guidelines. Okay, so guidelines, which means a set of rules and regulations that someone has to follow. And what are you reading for in a guideline? So we can say we are reading for the details. Okay, what about the second category? Manual, policy. So what are you reading for in the second category? We are reading for the main idea. Maybe, for example, the main idea about how a machine is working or an equipment is working, the function of a particular machine. Okay, so likewise we are reading for the main idea. And what about the third category? And in the third category, yes, Nijida, we are reading for the purpose. Okay, so to understand the overall purpose. Clear? So that's all about 3 different categories in part B. Okay, yes, Riba, main idea, it comes under the second category. Okay, yeah, so details, first category, main idea, second category, and third one, purpose. Okay, so that's all about part B. And what about the time? Total time? Any idea about the time? The time required to complete part B. Any idea about the time? So there is no separate time for doing part B and C. So together you will get 45 minutes. Okay, and out of this 45 minutes, we are spending almost, I can say, 12 minutes, maximum 10 to 12 minutes for the completion of part B. Okay. Yes, very good, Shanta. 10 to 12 minutes. Yes. Okay. So that's all about part B. Now let's move to part A. Okay. So we have another new topic here, which is urinary fistula. So yeah. So first of all, in the comment box, let me know about what are the keywords from text A as well as from text B, text C and text D. Okay, I'll give you 2 minutes. So please comment it here. What are the keywords from text A, text B, text C and text D. Okay. So from text A. So first of all, let's start with text A. So what are the keywords from text A? May I know? Yes, Shija, 45 minutes for B and C. Yes, dear. Very good. Okay, so for part B, it's almost 12 minutes. Okay. Yeah. So remaining 33 minutes, it's for part C. Okay. So what about the keywords from text A? May I know? What are the keywords from text A? Okay, Riba, Shanta, Libby, Imran, Shija, Nijida, then Janita, Alina, Monica, Dar Mohsen, Imran. Okay, Reshma. Yes, what are the keywords from text A? Okay, if you guys are commenting your keywords here, then I can correct you with that. Okay, so please let me know what are the keywords from text A. Okay, so I'll mark some keywords from text A and you guys can check whether it is correct or not. Okay, so yeah, coming to text A, urinary fistula. So first of all, the name of the condition, so that is urinary fistula. Then women. Okay, it's an abnormal opening between urinary tract organs that process and expel the urine out of the body, kidneys, then ureter tubes, bladder, urethra. Vaginal or urinary organ connections are also known as vaginal fistulas. Okay, then damage to the urinary tract, pelvic region or vaginal tissues can create conditions for a fistula. Then urinary fistula can form as a result of an injury or accident, surgery, radiation treatment or infection. So accident, surgery, radiation, then treatment, infection. The fistula may open after tissue degrades over time, which can range from days to years. As a result of the abnormal connection, feces and urine may leak from the vagina. The numerous types of fistula are possible. They are, then a vesico-vaginal fistula develops between vagina and the bladder. This is the most common type of urinary fistula in women. Then it occurs most often due to previous hysterectomy. Then a vesico-vaginal fistula can occur as a result of difficult labor. Then enterovesical fistula develops between the bladder and the bowel. Then this is one of the most common urinary fistulas. Then the last one, a vesico-uterine fistula develops between the urinary bladder and the uterus. So these are my keywords from text A. So what about you guys? Okay, Shanta, women. Okay, numerous type. Okay, any other keywords? Any other keywords from text A? Okay, so that's all about the keywords from text A. So if it is possible for you, so please let me know what are the keywords from text A so that I can correct you. Okay, so I'm coming back to the text. So we have 4 different texts here: text A, text B, text C and text D. So text B, it's all about the diagnosis. So first of all, I'm marking the heading: diagnosis, identification. Okay, the doctor may recommend a few additional tests to determine the precise location of fistula and the best way to treat it. These tests might include complete blood count, then excretory urogram, dye test, then a doctor can use a cystoscope to inspect the urethra and the bladder for fistulas or other damage. Then retrograde pileogram. This test is like excretory urogram, uses dyes and x-rays. Okay, so dye, x-ray, urogram, then leakage specifically between the vagina and the ureter. Then fistulogram, it is an x-ray image of the fistulas which can show whether one or more fistulas exist in which organs are affected. And the final one is CT or computerized tomography urogram. Okay, so these are my keywords from text B. Okay, so text C, here we have a pictorial. Okay, this is a table. Okay, it's actually not a table, yeah, a flow chart. Okay, so a lot of numbers mentioned here. 1429. Okay, then another numbers mentioned. So what about those numbers? So you can mark all the numbers connected to that one. Okay, so yes, so 1429, then 1389, 1354, then 1300, again something in bracket which is percentage, then 3, again the number, all the numbers. Okay, yes, and also I'm marking all the brackets here. Catheterization, incontinence, okay, rectovaginal fistula, surgery, yeah, that's all about that. Okay, then it's text D, the last one. Again, a lot of numbers mentioned here, as well as the name of a healthcare provider, so surgeon, then procedure, as well as the bracket, then fistulectomy 2021, the number, then 75%. Okay, then the name of the disease condition, Crohn's disease or diverticulitis, then UTIs, treatment or treating, medical, fistula, then intestinal cancer, again the name of the condition, vesicovaginal fistula. Okay, so these are my keywords from the last one. Okay, so now we are moving to the first question. Okay, so what about the first question? Any idea? Number of women were authenticated with urinary or rectovaginal fistula. So my keywords from the question, authenticated, women, then the name of the condition, rectovaginal fistula. Any idea? First question. Okay, so part A is all about locating certain answers from each of the text. Okay, so we can find out certain answers. Okay, Libby, first one is text C. Okay, so what do you mean by authenticated? Authenticated, which means here it's confirmation or confirm. Okay, so the total number of women were confirmed with urinary or rectovaginal fistula. Okay, Imran, it's from text C. Any other answers other than text C? Okay, so yes, coming back to part A, and it's all about 20 questions in part A. And these 20 questions, they have categorized into 3 different sections here. So the first one, 1 to 7, those are match the following questions, and we have 8 to 14, which are short answer questions, and 15 to 20, it's fill in the blanks. Okay, then in the short answer questions as well as in the fill in the blanks, you should be please aware about, you can write it in a word or a short phrase. Okay, not more than 3 words, maximum 3 individual words. Okay, and there is no repetition acceptable. Okay, you don't have to repeat any single word from the question into your answer option. Okay, but you can repeat names. Okay, if it is a name of something, a name of a person, or a name of a disease condition, name of an equipment, anything, name of a procedure, you can repeat names as well as you can repeat symbols. Okay, for example, percentage. Okay, likewise you can repeat names and signs and symbols. Otherwise you don't have to repeat any single word from the question into the answer option. Okay, so yes, coming back to the first question, so answer is C, right? Okay, very good. So that's from text C. Okay, so number of women were authenticated, confirmed with urinary or rectovaginal fistula. Answer is from text C. Okay, so where is it mentioned in text C? Confirmation. See, about the women, 1429 women enrolled and 40 women had incontinence unrelated to fistula. Then again, this much women confirmed. So it's all about the confirmation. Okay, so that's from text C. Then second question. Administration of the chronic cases of urinary fistula. Any idea? So my keywords, administration, then chronic, then the condition, urinary fistula. Administration, which means here it's management. Okay, the management of severe cases of chronic fistula. Any idea about the management? Okay, administration or the management of the condition. Yes, Monica? Okay, Libby. Yes, Imran. Any idea? Janita. What about the administration of chronic cases of urinary fistula? Where they've mentioned about the management, administration of severe cases. Any idea about administration or the management? Okay, so it's from text D. Okay, it's all about yes, administration of the condition. So what about that? The serious or severe conditions. In mild cases, it's you can go for a less invasive measures or something. So what about severe cases? Okay, if it is a severe case, if it is an intense case, yes. Okay, Kavita, it's from text D. So whether it is mild condition or chronic situations, we can go with a lot of management here. Okay, so that's from text D. So as well as mild conditions mentioned, then severe conditions also mentioned here. In severe cases, you can go with this. Okay, then what about the third one? The non-invasive techniques employed to treat urinary fistula. So what about the third question? Third one. So my keywords here, non-invasive, then employed, then treat. Again, treatment, non-invasive, techniques. Okay. So same like second question, third question is also from text D. Again, the treatment or non-invasive technique. So as you can see here, non-invasive technique as well as in mild cases, less invasive technique or measures mentioned here in text D. So answer is text D. Okay. Then fourth one, disparate categories of urinary fistula. So disparate, which I can say the distinct or different. Okay. So different types of, okay, categories, which here means types. So different types of urinary fistula. So disparate category. So these are my keywords from the question. So different kinds. What about fourth one? Different types of urinary fistula. Okay, so different types mentioned in text A. Okay, very good, Kavita. It's from text A. So different types, numerous types of fistula are possible. They are. So what are they? So these are. Okay, and that's from text A. Okay, Imran, very good, dear. It's from text A. Okay, so my answer is A. And fifth one, the assessment applied to ascertain the appearance of more than one fistula in the area. I mean, in the respected area. Okay, so assessment, then ascertain, which means identify. Okay, the appearance of more than one fistula in the area. Any idea? Fifth one, assessment, which means what? Determine, ascertain, which means determine. Assessment, I can say the tests. Okay, what are the tests? So where they have mentioned about different tests. Assessment applied, test used to identify the appearance, the presence of this condition. Okay, and that's from text B. As you can see here, in diagnosis, we are going with a lot of tests here. See? Okay, so what are the different type of tests mentioned here? Complete blood count, then excretory urogram, then test dye or dye test, then retrograde pilogram, fistulogram, then CT urogram. Okay, different types of tests mentioned, and that's from text B. Very good, Imran, it's from text B. Okay, then sixth one, considerable justifications for the growth of urinary fistula. So what do you mean by that? Considerable justification. So considerable justification, which means, okay, considerable reasons, which means multiple, different, variety of. Okay, so multiple justification here, which means not that justification, it's the reasons or the causes. Okay, so considerable, different or multiple causes for the growth of urinary fistula. Yeah, simply I can say that. Okay, different or multiple causes for the growth of, for the development of urinary fistula. Where is it mentioned? Multiple causes. What are the different causes of this condition? So here Yes, a lot of causes mentioned in the text A. Okay, in the first para as well as in the second para, it's all about what are the causes. Okay, it's all about what is urinary fistula as well as what are the causes, then different types of fistula. Okay, so that's from text A. I can mark it as text A. Then the last one, seventh one, the consequence of administering complete blood count in suspected candidates. So my keywords: consequence, administering, then blood count. Okay, so even though you have no idea about what is consequence, what is administering, but still blood count, the word blood count is mentioned here. Okay, as well as candidates mentioned. So what about that one, seventh one? The consequence, which means not that after effect here, consequence here which means the importance, significance. Okay, the significance of conducting complete blood count. Administering here which means conducting. Okay, Imran, it's from text B. Very good, dear. It's from text B. So answer is B. Okay, so what about text B? Where they've mentioned about the complete blood count, and that is one of the tests for this condition. So that is complete blood count. It is done to look for signs of infection in the body. Okay, so that answer is from B. Very good. So we are just jumping to the next set of questions, which is short answer questions. Okay, so the first one, eighth one. Medications employed. So name of the medications we need. Okay, medications employed, used to treat UTIs or other underlying infections correlated with urinary fistula. Any idea? Yes, Kavita, Libby. What are the medicines used here? Okay, Kavita, 7 out of 7. Very good, dear. Yes. Eighth one. Any idea? What are the medications used to treat UTIs? The medications which we use. What medications we are using? So, of course, the treatment is mentioned in text D. So, you can go with text D. So, what medications we are using? Okay. So, treatment of UTIs or other underlying infections with antibiotics. So, what medications? Antibiotics. So, answer is antibiotics from text D. Okay, antibiotics should be the answer. Then next one, ninth one. Which fistula is appraised as the typical urinary fistula? Which fistula? Okay, any idea which fistula is appraised as the typical common urinary fistula? Okay, and that is from text A, because different types of fistula mentioned here. And what type of fistula? And that is from this second last line. An enterovesical fistula develops between, okay, so apprised, which means it is developed, okay, between urinary, bladder and the bowel. So this is one of the most common, so which means typical, okay, urinary fistula. So answer is an enterovesical fistula. Okay. Yes. Okay, Akku, ninth one. Okay, dear, it's not vesicovaginal, dear. It's enterovesical fistula. Okay, it's okay. Okay. Yeah. So, 10th one. The approach would make use of an electric current to treat irregular vaginal mucosal layer in vesicovaginal fistula. So, what about that one? 10th one. What approach? What approach, which means what method? Yeah. Okay. So, my keywords. Yeah, these are the keywords. So, what approach? Any idea? What method? Again, the method or the treatment which is mentioned in text D. In the case of mild vesicovaginal fistula, that is one of the keyword from the question, using vaginal electrocoagulation. So, yes, answer is this from the last line, text D, vaginal electrocoagulation. Okay, but already in the question, they have mentioned about vaginal mucosal. So, you don't have to write or you don't have to repeat the same word there. So, just write electrocoagulation. So, answer should be electrocoagulation from text D. Yes, Kavita, your answer is correct. Yes, vaginal electrocoagulation. Okay. Then 11th one. Which test resembles as an excretory urogram, where a dye is injected into a vein to allow the doctor to examine the vagina and lower urinary tract? So, which test? All the tests mentioned in text B. So I'm just moving towards text B. Okay, and what test we are using here? Okay, it is CT urogram. So answer is CT, or computerized tomography urogram. So that is the particular test we are using, similar to an excretory urogram. That is, dye is injected into a vein to allow the doctor to examine the vagina and lower urinary tract. So answer is computerized tomography urogram, or CT urogram. Okay, Nijida, it's not dye test, it is actually CT urogram. Okay, exactly the last one. Okay, so what about the question? Yeah, urogram is already there in the question, so you don't have to repeat the same. Answer is CT, or computerized tomography. Okay, Kavita, CT from text to be. Very good, dear. Exactly. Okay, Libby, CT. Yes, CT. Then 12th one, the type of fistula that may develop between the urinary bladder and the uterus. So what type of fistula? So type of the condition or the fistula, where they've mentioned about type of fistula. 12th one. So types, as I already know, which is from text A, numerous types of fistula. So which type of fistula? 12th one. Okay, so that is vesicouterine fistula develops between the urinary bladder and the uterus. Okay, that's from, 12th question, that's from text A. Vesicouterine fistula from text A. See the last line. Okay, answer should be vesicouterine fistula. Okay, then 13th one, the presence of which condition alone made 26 patients excluded from the analysis. So 26, then presence, condition. So what about that one, 13th one? Presence of which condition? What condition? Okay, very good, Reba. The condition is, it's called RVF. Okay, so RVF, which is mentioned in text C. Okay, so 1274 with urinary fistula or combined urinary fistula, or RVF, as well as here 26 women were excluded from. So that is one of the keyword from the question. Analysis presented here because they did not have a urinary fistula or RVF only. So answer is RVF. Okay, very good. Yes, Reba, Libby, yes, Anuja, Imran, Nijida, it is RVF. Very good. And what about the next one? The last one, 14th one, the long thin instrument used to inspect the urethra and bladder for fistulas or other damage. So long thin instrument. So what instrument we are using for that? Okay, any instruments mentioned anywhere in the paragraph? I mean anywhere in the text? Name of an instrument? Okay, name of an instrument. Anywhere mentioned about name of an instrument? Okay, 13th one, RVF. Yes, Kavita. Yes. So what about 14th one? What about 14th one? Yes. Okay, Imran, it is cystoscope. Yes, it is a doctor use a instrument. What instrument? Cystoscope, which is long, thin device with a camera. So answer is cystoscope. Okay. Then the last set of questions, which is fill in the blanks. So first one. An endovesical fistula commenced by dash has to be treated by extracting the entire intestine plus part of the bladder. Okay, 15th one. An endovesical fistula commenced by dash. So what? Any idea? An endovesical fistula commenced by dash has to be treated by extracting the entire intestine plus part of the bladder. 15th one. Okay, I'll give you a clue, which is from text D. Any idea? Text D. Okay, so that's from text D. What is the correct answer? Surgeon, right? It's not surgeon. So what is the question once again? A vesicovaginal fistula can be developed, an enterovesical fistula commenced by dash has to be treated by extracting the entire intestine plus part of the bladder. Okay, Anuja, I don't think so. It's not surgeon. Any other answers? Okay. Any other answers? So, which is from text D. Okay. Any other answers? So, that's from here. For example, in the case of an enterovesical fistula due to intestinal cancer, the surgeon will need to remove the entire intestine plus part of the bladder. So, answer is intestinal cancer. Okay, it's not surgeon, it is intestinal cancer. Okay, here commenced by, which means due to. It is because of. The reason is because of dash, because of intestinal cancer. So, answer is intestinal cancer, not the surgeon. Okay, so answer is intestinal cancer. Okay, 16th one. A vesicovaginal fistula can be developed due to previous hysterectomy or from a dash. Very good, Libby. Answer is difficult labor. So, where is it mentioned? Difficult labor, which is from text A. As you can see here, a vesicovaginal fistula can occur as a result of a difficult labor from text A. Okay, and the next one, 17th one. A dash may be performed in more severe cases where the surgeon removes the entire fistula and as well as part of all of the affected organs. So, what? A dash may be performed. What may be performed? Okay, Akku, it is difficult labor. Yes, dear. So, what about 17th one? A dash may be performed. So, what is performing? Okay. Yes, it is again in text D. Any idea? A dash may be performed. So, what is performing here? What is performing here? See, they may also perform a fistulectomy where they remove the entire fistula as well as part of all of the affected organs. So, answer is fistulectomy. Yes. Okay, Vidya, very good, dear. It says fistulectomy. Okay, so that's from text D, the second line. Then 18th one. Dash is an X-ray image of the fistula which can show whether one or more fistulas exist, which organs are affected. Okay, Nijida, fistulectomy. Okay, Anjali, it is fistulectomy. So, what about 18th one? 18th question. Dash is an X-ray image. So, what is an X-ray image? Again, it's a kind of test. Okay, so that's from text B. Any idea? It is an X-ray image. So, what do you mean by this it? It, which means in the previous line, that is fistulogram. Okay, answer is fistulogram from text B. It is an X-ray image. So, it means fistulogram. So, answer is fistulogram. Then 19th one. A urinary, okay Imran, very good. It is fistulogram. Okay. Then a urinary fistula in women is an abnormal opening between dash organs that process and expel the urine out of the body. Okay, opening between dash organs. So, what organs? Okay, again that's from text A. Okay, see the first sentence. A urinary fistula in women is an abnormal opening between urinary tract organs that process and expel the urine out of the body. So, answer is urinary tracts. Okay, that's from text A. So, the first line, urinary tract. So, we are moving to the last question, 20. Among the 1,354 women underwent fistula repair surgery, dash women were discontinued for lost or follow-up. So, how many women? Here we need a number. So, the number which is mentioned in text is C. And what about the number? Discontinued. Okay, so answer is, it is 54 women. See, follow up. Okay, so answer is 54 from text C. Okay, so any doubts regarding any of the questions? Anyone with 20 out of 20? Any 20 out of 20 for this part? Urinary fistula. Okay, Libby, you got 20 out of 20. Okay, Riba, excellent, 20 out of 20. Okay, what about others? Anyone else? Okay, Imran, excellent, yeah, 20 out of 20. Okay, Okay, Kavita, 20 out of 20. Very good. Okay. Okay. Most welcome, dear. Okay, most welcome. Okay, Libby. Yes. Okay, Imran, 20. Very good, dear. Okay. Okay, Anjali, 20. Okay. Excellent. So, that's that. Okay. So, thank you so much. See you tomorrow. Take care. Bye.